5 signs elderly people show a year before their final days. What if I told you that the body often gives warning signs months, or even a year, before death? Many people believe that passing away in old age happens suddenly, but in reality, the body starts showing small changes long before. The problem is, these signs are often mistaken for normal aging, and families miss the chance to prepare. Imagine being able to recognize these signs early. It would allow loved ones to provide better care, share meaningful moments, and make sure the final stage of life is peaceful and dignified. No one wants to leave things unsaid or feel unprepared when the time comes. In this video, we'll go through the early signs that may appear before the body shuts down. These are not just random changes, they are signals that the body is slowing down in a natural way. Some signs might seem small, like a sudden lack of appetite or sleeping more than usual. Others might be more noticeable, like personality changes or withdrawing from loved ones. By understanding these early warnings, you can take the right steps, whether it's seeking medical advice, offering comfort, or simply being present for someone you care about. Every moment matters, and knowing what to expect can make all the difference. Stay with me as we go through each sign, one by one. Some of these may surprise you, but they are important to recognize. And if you want to keep learning about life beyond 50, how to stay strong and be prepared for every stage ahead, make sure to subscribe. This channel is here to guide you with simple, clear insights that truly make a difference. Now, let's get started. 1. Significant weight loss. One of the first and most noticeable signs that the body is nearing the end of life is unintentional weight loss. This means losing weight without trying, often over weeks or months. Many families assume this is just a normal part of aging, but in reality, it can be a sign that the body is slowly shutting down. Why does this happen? As people grow older, their bodies become less efficient at absorbing nutrients from food. This means that even if they eat regularly, they may not be getting enough energy and nutrients to maintain their weight. Over time, this leads to muscle loss, which makes movement harder and increases the risk of falls. Weak muscles can also make it difficult to do simple daily activities like walking, getting up from a chair, or even holding objects. Another reason for weight loss is a weakened immune system. As the body gets weaker, it struggles to fight off infections, which can lead to illness and further weight loss. This can make even minor sicknesses much more dangerous. Changes in appetite. One of the biggest reasons for weight loss in the final stages of life is a decrease in appetite. Many older adults stop feeling hungry, and even their favorite foods no longer seem appealing. This can happen for several reasons. Changes in taste and smell. The senses become weaker, making food seem bland or tasteless. Less energy to eat, chewing and swallowing can become tiring. The body's natural decline. As the body prepares for the final stage of life, it no longer needs as much food. Because of this, forcing someone to eat may not always help. Instead, it's better to focus on keeping them comfortable and offering foods that are easy to eat, such as soups, smoothies, or soft fruits. Medical causes of weight loss. Sometimes, weight loss is linked to a serious health condition. Diseases such as cancer, heart failure, kidney disease, or Alzheimer's can lead to a lack of appetite and energy. Even mental health issues like depression can cause people to eat less and lose weight quickly. If weight loss happens suddenly, it's always a good idea to check with a doctor. However, if the body is naturally slowing down due to aging, there may not be a way to stop it. Instead, the focus should be on making sure the person is as comfortable as possible. What can be done? While weight loss in the final stage of life can't always be reversed, there are ways to provide care and comfort. Offer small, easy-to-eat meals rather than big portions. Keep them hydrated with water, herbal teas, or broths. Make mealtime enjoyable by eating together and keeping a calm atmosphere. Don't force food, focus on what they enjoy and can eat comfortably. In the end, quality of life matters more than weight gain. Recognizing this sign early can help families prepare emotionally and focus on giving their loved ones the best care in their final stage of life. 2. Extreme fatigue and weakness. Feeling tired is normal, but when someone is nearing the end of life, their exhaustion is much deeper than regular tiredness. This kind of fatigue doesn't go away with rest and makes even simple activities feel like a challenge. The body starts focusing only on the most important functions, which means there is less energy for moving, talking, or even staying awake for long periods. As the body slows down, everyday tasks like getting dressed, walking, or even holding a conversation become difficult. A person may need more help from others or take longer to complete basic tasks. They may also start sleeping much more than usual, taking long naps during the day and spending more time resting. This increased sleep is not just from tiredness, it is the body's way of slowing down as it prepares for the final stage of life. One of the main reasons for this weakness is a decrease in circulation and oxygen supply. As the heart and lungs slow down, they are not able to send as much oxygen to the muscles and brain. This can make movements feel slow and heavy. Even lifting a spoon or sitting up in bed may feel exhausting. Some people may also feel lightheaded or dizzy when they try to stand or move too quickly. This extreme tiredness also has a strong emotional impact. Many seniors feel frustrated or embarrassed by their weaknesses. They may feel upset that they can no longer do things they once enjoyed, like cooking, gardening, or playing with grandchildren. This can lead them to withdraw from social activities, avoiding conversations, and skipping family gatherings. Over time, they may stop showing interest in watching TV, reading, or listening to music, which can make them feel even more isolated. For family members, this can be a difficult change to see. It's natural to want to encourage the person to stay active, but forcing activity won't help. Pushing someone to move more than they can handle may cause stress and discomfort. Instead, it is important to focus on comfort and support. Helping with daily tasks, encouraging rest, and respecting their limits can make a big difference in preserving their dignity and peace during this stage of life. Small actions like sitting with them, playing soft music, or holding their hand can provide comfort and reassurance. 3. Increased cognitive confusion or withdrawal. As the body nears the end of life, changes in the brain can lead to noticeable shifts in memory, thinking, and engagement with others. A person may seem forgetful, struggle to follow conversations, or even repeat themselves without realizing it. Simple tasks like remembering names, keeping track of time, or making decisions may become difficult. In some cases, there are moments of clear thinking, but these are often followed by periods of confusion. One of the main reasons for this cognitive decline is reduced oxygen and blood flow to the brain. As the body slows down, the brain doesn't receive the same level of support it once did, leading to memory lapses and difficulty processing information. These changes are not always constant. Some days may be better than others, making it even more confusing for family members and caregivers. Along with cognitive changes, many people begin to withdraw from social activities. Someone who once enjoyed chatting with family and friends may now sit in long periods of silence. Conversations might feel overwhelming, especially in noisy or crowded environments. They may not respond as they used to or might seem uninterested in what's happening around them. This isn't necessarily because they don't care, it's often because their brain is processing things more slowly, making it harder to keep up with social interactions. Emotional changes can also be noticeable. Some individuals become more irritable, anxious, or frustrated, especially when they realize they are forgetting things. Others may seem unusually calm or distant, showing little reaction to things that would have once mattered to them. These shifts in behavior can be difficult for loved ones to witness, but they are a natural part of the body's transition. The best way to respond to these changes is with patience and understanding. Instead of trying to force conversations or push them to be more engaged, it's important to meet them where they are emotionally. Speaking in a gentle, reassuring tone, keeping the environment peaceful, and avoiding too much stimulation can help them feel more at ease. Even if they don't respond much, sitting quietly with them or holding their hand can provide comfort and a sense of connection. 4. Frequent infections and slow healing. As the body ages and nears the end of life, the immune system weakens, making it harder to fight off infections. Someone who once recovered quickly from minor illnesses may now experience frequent colds, flu, urinary tract infections, UTIs, pneumonia, or skin infections. These infections linger longer, and wounds may take weeks or even months to heal. In some cases, cuts or sores may reopen repeatedly, leading to ongoing discomfort and increased risk of complications. One challenge with infections in older adults is that they don't always present in the usual way. For example, instead of a high fever, they may show signs like increased tiredness, confusion, or loss of appetite. A UTI, which might cause pain in younger people, could instead result in sudden confusion or agitation in an elderly person. These subtle symptoms can sometimes delay proper treatment, as families and caregivers may not immediately recognize them as signs of an infection. As the body's ability to heal declines, aggressive treatments like antibiotics or hospital stays may become less effective or even cause additional stress. At a certain stage, the focus shifts from trying to cure every illness to maintaining comfort and quality of life. This means prioritizing hydration, skin care, good hygiene, and reducing stress to prevent infections and keep the individual as comfortable as possible. Instead of focusing on endless medical interventions, families may choose to focus on keeping their loved ones at peace. Simple actions like keeping them hydrated, ensuring soft bedding to prevent sores, and maintaining a calm environment can make a significant difference in their well-being. Recognizing when to shift from medical treatment to comfort care is an important step in ensuring a dignified and peaceful final stage of life. 5. Major changes in breathing or circulation. As the body starts to slow down, breathing and circulation also begin to change. These changes can be subtle at first but become more noticeable over time. One common sign is irregular or labored breathing. The person may start taking shallower breaths, or their breathing might slow down significantly. In some cases, there may be pauses between breaths, a pattern known as Cheyne-Stokes respiration. This can be unsettling for family members to witness, but it is a natural part of the body's decline. Circulation also weakens, meaning the heart is no longer pumping blood as efficiently as before. This can cause the hands, feet, ears, and nose to feel cold to the touch. The skin, especially on the fingers and toes, may appear pale, bluish, or mottled as blood flow decreases. These changes are most visible when the body starts conserving energy for only the most essential functions. Breathing may also become more difficult, even with small movements. Someone who could once walk around the house without issue might now feel winded after just sitting up. You might also notice them breathing through their mouth more frequently, as their body tries to take in more oxygen. In some cases, there can be fluid buildup in the lungs, leading to a wet, gurgling sound while breathing. They may start coughing more or complain of chest tightness. Lying flat might feel uncomfortable, so they may prefer sleeping in a slightly upright position. Rather than trying to fix these breathing issues, the best thing to do is focus on comfort. Keeping the room cool, using a humidifier, or offering small sips of water can make a big difference. Gentle reassurance and a calm environment can also help ease any distress. These changes may seem alarming, but they are a natural part of the body preparing for its final stage. These 5 signs, weight loss, fatigue, cognitive decline, frequent infections, and changes in breathing and circulation, are often seen in the final months or years of life. They don't always appear all at once, and they don't necessarily mean that passing is imminent, but recognizing them can help families prepare emotionally and practically for what's to come. Instead of trying to fight against the natural decline, the focus should shift toward providing comfort and dignity. This is the time to make important decisions in advance, ensuring that your loved one's final stage of life is as peaceful as possible. It's also a chance to cherish meaningful moments, whether through conversation, simple gestures, or just being present. Understanding these signs doesn't just help the person going through them, it helps family members find peace, patience, and strength in one of life's most difficult transitions. If this video helped you gain clarity on this important topic, make sure to subscribe to Life Beyond 50. Here, we talk about real-life challenges, health, and aging with dignity, giving you the knowledge to navigate this stage with confidence. Click the subscribe button now so you don't miss out on more valuable insights that can help you and your loved ones live a more prepared, fulfilling life.